I remember exactly where I was standing, who I was talking to when we discovered that our first patient.
COVID's arrival in Colorado is a moment forever burned into our memories.
I remember who the nurse was. I remember what room that patient was in. And just that reality hitting of this is coming. This is coming to us.
1 year later, Jen Lingle is still on the front lines. She's an ICU nurse at North Colorado Medical Center in Greeley.
We talk about how just driving to work every day, our anxiety starts to go up because it's just there now. It just feels like it's always there. It's going to take a lot of time to heal, to get back to feeling like we can go to work without that fear of what may come through those doors.
It was hard to watch 30s, 40s, 50s-year-old people that were otherwise relatively healthy really struggling to try to overcome this disease.
As the community locked down and masked up, frontline healthcare workers dug in. Dr. Frank Wright is a trauma surgeon at University of Colorado Hospital.
There was a lot of people hours spent in trying to prepare for every possible scenario that we could come up with.
But it also taught me that it's okay to not be okay.
Off the front line, they are spouses and parents too. Jen even had a baby last year.
I kind of relate it to becoming a parent. Like, you can read all the books you want on past pandemics, but once it happens to you, it's one step at a time.
Today, both are vaccinated.
It takes some of that mental weight of feeling like we're putting ourselves and our families at higher risk. It takes a big portion of that off of our minds.
Both are seeing fewer patients in their hospitals, and both are feeling some hope.
We're breathing now. We're breathing. I hear laughter at the nurses' stations again, and it's good to hear.
Jennifer Meckles, 9 News.